Dr. Goulden, thanks for joining us on Health Connection again. It's always a pleasure.
Yes, sir.
Our topic's high blood pressure, the silent killer. And for a lot of reasons, a significant number of Americans have high blood pressure, but diagnosing it and prescribing medication isn't all that needs to be done. So let's get into this topic. The CDC estimates that 1 out of 3 Americans has hypertension, about 70 million people. Do most Americans understand how serious a health problem this is?
Well, I think if we went back 5 years, the answer would probably be no. But over the last 5 years, or maybe a little longer, there's been intense public education from governmental agencies and from health agencies trying to make sure people got the message. So I would say that probably that we know the awareness of high blood pressure has dropped. So if you took the people who didn't have high blood pressure, just say 60% of them with it didn't know they had it, now that number is much lower. So the awareness is increasing, and I think that's well documented. But probably it's fair to say most people don't know they have it.
Well, let's talk about that. Even though high blood pressure is called the silent killer, some people claim they can tell when their blood pressure is high. Is that true?
Well, I think you have to keep in mind that if you go out and exercise, your blood pressure goes up normally, and you may feel like your heart's pounding and like your blood pressure's up. But when we talk about high blood pressure or hypertension, we're talking about blood pressure that's up maybe 24 hours a day. And generally that's felt not to cause a lot of symptoms until late in the process. So there may be what we call a latent period of 20 years from the onset of high blood pressure to the development of target organ damage.
Okay. What are the most common causes of hypertension?
Most common cause is what we call essential hypertension, which means there's no one specific cause for it. It probably has to do with the resistance in the arteries in the body, which raises the blood pressure. Other common causes, however, are such things as chronic kidney disease. Very rarely compared to that are adrenal tumors, maybe hardening of the arteries involving the kidney arteries, things of that nature. But the vast majority, there's no specific cause.
Okay. Family history. One or both of your parents has hypertension. Are you significantly more likely to get it? And what does that tell you about what age you should start monitoring?
High blood pressure definitely runs in families, and for a long time there was complete unawareness that adolescents might have high blood pressure. But just like the general population has been educated, so has the population that treats adolescents, so that now blood pressure should be checked in adolescents, whether they have a positive family history or they don't have a positive family history. In other words, you cannot ignore the pediatric age group until they're age 20 or 25. You need to start when you check them, you check their blood pressure. So that's more of a routine now.
Okay. We know that some ethnic groups are more prone to hypertension, suffer it in higher numbers. For example, African Americans have a higher incidence of hypertension, and often starting at a younger age. Do we know why?
Some of it's genetic. Some of it seems to be how sodium and potassium are handled in the body, so that we always talk about low sodium diets, but we also need to be talking about high potassium diets. And these substances are felt to play a role in high blood pressure, and they tend to affect different populations. So that the African American definitely has a higher incidence, and African American women have a higher incidence usually than African American men.
Okay. You talked about organ damage. Let's talk about the organs in the body and the effect that high blood pressure has on them. Let's start with the heart. What will high blood pressure do to the heart?
Generally, it will cause enlargement of the heart and congestive heart failure. And the big concern is congestive heart failure. And one of the major causes of congestive heart failure is high blood pressure. That goes back to how long you have high blood pressure. It takes generally many years to develop congestive heart failure from high blood pressure, and you may be completely unaware that you have it. So it'll cause enlargement in the heart. It's a risk factor. One of the major risk factors for hardening of the arteries or atherosclerosis. That's the second thing. And I guess if it's severe enough and you have enough heart failure, you can develop valvular heart disease. But we don't necessarily. We think more of congestive heart failure and atherosclerosis.
All right. Kidneys. What about high blood pressure in kidneys?
Chronic kidney disease, the effect of the high blood pressure on the kidneys handles how the kidneys function, how they filter fluids, sodium, potassium. It can cause damage to the glomeruli, which is the filtering system in the kidneys, and cause elevation of the kidney blood test, creatinine, BUN. So it can cause renal failure.
Okay. You talked about it a moment ago. You talked about sodium, salt.
Yes, sir.
What is its role in hypertension?
There's been a feeling that the American diet is way too high in sodium. You may consume as much as 10 to 15 grams of sodium a day or salt a day, and that your diet intake may be 6 grams of sodium a day. What's felt to be necessary is about 2 grams. So the recommendation has been that the sodium in diets is way too high and that we need to drastically cut down the amount of sodium that we take. So going from 6 grams of sodium a day to 2 grams of sodium per day. There is some debate on that, and not everybody agrees with the different targets for the amount of sodium. But if you're taking in 5 times what you need, it's probably logical to assume that if you cut that back, it would be helpful. And it is. It does help with fluid retention, and it does help with high blood pressure.
You may have just touched on it. What does the salt do that causes your blood pressure to be elevated?
Good question. It causes retention of fluid, but it's more than just increasing fluid in the body. It has an effect on the resistance of the arterioles, and these are the smaller arteries, and when the resistance goes up, then the blood pressure goes up. The exact mechanisms are not completely worked out as much as this has been investigated.
All right. Other foods and hypertension.
Well, other foods and hypertension, we really are looking at the sodium content of foods, and it's also felt that you need to maintain the correct amount of potassium in your diet. So when you say other foods, you're saying what other foods are high in sodium? And generally, the way I would answer that question is there's a diet plan called the DASH diet, which stands for Dietary Approaches to Stop Hypertension. It's available on the internet, and it's an excellent resource as to what kind of diet to find. Basically, high in fruits, high in vegetables, low in sodium, low in high fructose corn syrup, which is in soft drinks. That's basically the crux of the diet.
Okay. There's ongoing research in this area for high blood pressure. Are we learning anything new?
There's been, I would say most of what we've learned new has been in the pharmacology or the treatment of high blood pressure. We have many treatments available for high blood pressure, different medications. I'm talking about different classes of medications. And ongoing research seems to be clinical research directed at the pharmacologic therapy of high blood pressure. There's not been a lot new as to the actual cause of high blood pressure, so it's mostly on the pharmacology of it. And I should point out that there are many good high blood pressure medicines, and for the most part, these medicines are in the low-cost group, so that anyone who needs treatment for high blood pressure should be able to afford it. We have multiple choices. I also want to add, we were talking about organ damage, and I want to remind everyone that the major risk factor for stroke is high blood pressure. So one of the reasons, so we're worried about heart failure, but we're also worried about strokes. And that's another focus in this country, is treatment of stroke.
You just mentioned medicine. Millions of Americans taking medicine to control high blood pressure. It's a very common treatment. What can we do besides medicine to control our hypertension?
Lower the sodium in your diet. Try to achieve a normal body mass index, in other words, the normal body weight, and exercise. And we're talking about the standard for exercise that you can work up to is 30 minutes a day of a moderate intensity exercise 5 days a week. So 150 minutes a week of a moderate exercise such as walking, weight control, lower the sodium in your diet, and take your medications. I mean, that's another problem is a lot of people are prescribed medicines. They don't necessarily take them faithfully because they're not having any symptoms, so they think that they don't have to take them.
All right. Doctor, we learned something as always. Thank you very much.
You're welcome.